A renewed focus on an old-fashioned treatment that potentially could be helpful for COVID-19, plus some interesting data on what we're consuming during this pandemic. What are you drinking right now? No judgment on our part, but some interesting data. So let's start overall with the pandemic picture in America. We're seeing a couple different headlines, flurries, if you will, about what's happening in the United States. The president yesterday talked about a decrease in positive cases. At the same time, you're seeing some governors, like in the state of New Jersey, a former hotspot of COVID-19, put again restrictions on public activity because of concerns about a rise in cases. Now, two things can be true at one time. We can see nationally positivity rates drop, as the president was talking about a drop in positive cases, while you're seeing concerns in certain cities or certain regions. And that's what we're seeing in New Jersey. That's what we're seeing across the Midwest. Today in Hawaii, schools were supposed to open. They're being delayed. So we're seeing these different pictures emerge about overall nationally what COVID looks like, and then really on a state or local level. Be very careful with any headlines, whether it's someone talking about an increase in cases or a decrease in cases, because you really need to see the data. Is the increase in cases going from 2 to 4 or 2 to 400? Is the decrease going from a decrease of 10% to 9.5%? What does that actually look like? So just be aware that as you see those headlines, the data is really significant. One of the big questions that emerges, of course, when it comes to COVID-19 is treatment. We've talked about vaccines. A lot of you have had questions. We're looking more into the vaccines that are being developed and being tested. We know that every few weeks, 30,000 Americans are entering these historic vaccine trials. So one of the questions we had is, well, what about therapeutics? You know, we don't have a vaccine for the common cold. The vaccine that, when it's considered effective for the flu, is about 50 to 60% effective. It's the therapeutics that really help treat people with severe cases of the flu, for example. So I was curious just how many participants we have in therapeutic trials. Is it the same as vaccine trials, for example? I'm still working through some of the research. I reached out to the FDA yesterday. They were nice enough to get back to me with some information. In one trial for convalescent plasma, we're seeing more than 80,000 participants. We've talked a little bit about convalescent plasma. It is an old-fashioned treatment because it's been used, for the past 100 years. Is when someone who had an infection shares their blood plasma, with someone who's experiencing that infection in order to share the antibodies, to boost the person with the infection's immune system, if you will. Loosely, it can be what a vaccine does as well, but you don't need the vaccine. We just get to share. And so there is an op-ed I want to call your attention to in the Washington Post. 4 different former FDA commissioners who worked for different administrations, Republican and Democrats, really saying we should focus on convalescent plasma. They're saying that the United States is a leader when it comes to plasma therapy, and they believe this is where we really should focus strong randomized clinical trials. Without being overtly critical, they use hydroxychloroquine as an example, saying we didn't have the controls on these trials that we needed. It's caused a lot of confusion. This treatment has shown a lot of promise. It's worked in the past for a variety of different infections and diseases. It may work here. And here's what's interesting. It can be accessible. It can be cheap. We've done it before. And so I really want you to kind of zone in on this as a potential therapy. It's something we're going to be looking into more. And now we have some really leading voices saying that the US government should look into it. The president and others is really calling on anyone who has survived COVID-19 to donate their blood, because they want to see these trials gain speed. We have information on that on our website, by the way. A couple of things I want to point out to you. Remember, it's all in a name, right? We talk about COVID-19. We have to remember the virus that causes COVID-19 is SARS-CoV-2. Ironically, the former FDA commissioner said that convalescent plasma was tested for the original SARS virus as well. I want you to think of a name when you keep hearing tropical storm. We have a tropical storm that's hitting America right now. A tropical storm is the same as a tropical cyclone. If you said tropical cyclone, would you feel differently about it? It sounds more serious, doesn't it? Same thing. The difference between a tropical storm and a hurricane is wind speed, but really the concern when it comes to storms is flooding. 1 out of every 3 Americans is going to be affected by this storm, so heads up, that's hitting the East Coast. It's going to be a big story over the next few days. Just want to touch on this briefly. There's been a lot of questions about violence in U.S. cities, the role of the federal government versus the local government. What's going on in U.S. cities as far as crimes? Data is very difficult to gather because it's very much voluntary between cities and states to share with the federal government. So it's hard to find that like perfect database. The Wall Street Journal just did some interesting analysis on crime in American cities. And what they found is that there's a trend of a rise in homicides and a drop in violent crimes. Why is that happening? It's something we're going to take a closer look at, and you're going to see on our website today, because it gives us a broad picture of what's actually happening in America during this pandemic and some thoughts as to why. Okay, final thing. What are you consuming during the pandemic? Do you have a favorite go-to drink? We talk about this being coffee talk because it's early in the morning, it's still dark outside. Two different trends we're seeing. Champagne sales are way down during the pandemic, so much that champagne producers are concerned, calling this worse than the Great Depression for them. People aren't choosing champagne, less celebrations. Champagne sales are down. What are we seeing up? Sales in the United States of milk is up. And by the way, also alternative milk products, so like oat milk, for example, is up. But milk is seeing a big increase in sales. You know, some theories are people have more time at home to enjoy a bowl of cereal. Maybe kids are home. What are you drinking? I'm curious. Is it milk? Is it champagne? Again, no judgment. A couple stories just to keep an eye on. We'll have those on our website. Hope you guys have a great day. And questions, comments, let me know. Always more on smarternews.com. Bye, guys.